other systems of the body, and you can look at the videos on YouTube for that. So the big question often asked is, what is THz? And the way some people speak as if THz is some sort of magic, come out of the blue and it can do wonders to you. No, it is not. THz has been known for a long time. So it's the radiation that lies in a particular region of the spectrum called it's between what is known as the microwave and the infrared regions. So it's about the frequency is about a trillion, 10 to the power of 12. That's a trillion. So what is it used for? When first discovered, THz was used in telecommunications. Okay? So I'm sure you use handphones, likely 4G, right? If you're using 5G, 5G waves are in the microwave range. Okay? Coming 6G. 6G use terahertz range. So these are real waves that have other applications besides what we're using them for. So terahertz was basically used in this and for detecting substances in security. It's very effective and it can detect a lot of things. And the interesting thing is, as far as the body is concerned, the molecules appear to have a certain frequency. So it's kind of a fingerprint that tells you what it is. Okay? So that's the technology of terahertz. Okay? So electromagnetic spectrum, this is a spectrum which includes visible light. Visible light is from here to here only. Very narrow band. Okay? Of higher frequency, you have ultraviolet and X-rays. Now, all these are very harmful to the human body. They can cause mutation. These are very harmful. So lower range is non-harmful. You have radio waves, you have microwaves, infrared. Terahertz is between microwave and infrared. Okay? So we were able to use radio waves for a long time. We studied electronics. And it's only 1990s that techniques evolved that can actually generate, monitor, and detect. So that's a breakthrough. Then in 2011, a scientist was able to use terahertz waves to analyze a painting, and they were able to uncover a name, an artist's name below it. You know, a painting you can paint on top of it and you have a total different painting. When last time canvas was scarce, that's what they do. They don't want to waste paper. So they paint over it. See? And they uncover the name and also the hidden pattern, the earlier painting that was made on it. So for a long time people talk about the terahertz gap between X-rays, infrared and radar waves. What is the terahertz gap? This is the gap. Visible light is here. X-rays, all this was studied under photonics or light. And all this, radio waves onwards, was studied under electronics. So this is a gap. It's a place where nobody knows what techniques to use. Now, of course, we have techniques that can be used. And if you know, silicon chips, there's a battle between US and China, right? And if you're in the news, you know that some Chinese scientists have come up with this photonic chip that makes use of light. So terahertz is part of the technology that is being used. So this information is just useful for you to understand that terahertz frequency is not something in the imagination. It can be detected, it can be generated, and there are applications in many areas. So what are the applications? As we said earlier on, telecommunications. 6G is primarily terahertz. And you know that China is in the forefront of 6G research, isn't it? And military and security has a lot of application. It can look through plastic. Okay, radio waves can travel much faster and longer and penetrate with longer distances. THz, it can do that but shorter distances. That's why if you notice that as you get to this THz range, you find 4G, weak signal you can still use it. 5G, the base station get closer and closer, isn't it? Because they can't go that far. 6G is even worse. It's that precise, you see. So where is it used? It can go through plastic, textile, anything. All this material, you can put THz emitter here and it can detect on the other side of the room. Even though there's a door in between, it can penetrate a lot of substances. In health and science, it's very important because it's non-ionizing. And because another thing we know is that it resonates at the frequency of the cell. Everything resonates. Chairs, metals, everything has a frequency. Okay? So our cells resonate at this frequency. That's why it's called the light of life. So, how does THz heal you if you use it on your body with all your aches and pains and all the problems of your health? Well, two things. One is the heat itself. You know that sunlight heals, isn't it? Sunlight has the ability to transform chemicals in your skin and make it into vitamin D, right? You know that. And people who don't have vitamin, especially housewives who stay at home all the time, they lack vitamin D. And their bones soften. As a result, some wives who are always at home doing all the cooking, washing and all that, they have bow-legged or ox-legged, where the bone becomes soft. And when the bone becomes soft, that's what happens. Another reason how THz can heal you is because of the vibrational energy, the frequency itself. So there are two ways. This is the more important one. So I was just discussing just now. How do you prove that THz heals? Very simple. Let's say if you have a skin disease, when you prove it heals, this side you use THz, this side just use the hair blower, just the heat, and you can see the difference straight away. Which will heal. After maybe a week, you will see the difference. So heat alone, while you can heal, you can push out toxins, you can penetrate, you can activate water molecule. Vibrational frequency is more powerful to cause the changes. Just like in the skin, you can manufacture vitamin D from sunlight. So the application in medicine are two. One is diagnostic. There are a lot of research done on using THz to look at things. You know that we use MRI scans and all that, very effective, isn't it? They're all the same type of waves as THz, but they're different type of waves. So THz can be used as well to make diagnosis. And when you use THz, you can pick up a lot of, you can differentiate a lot. For example, THz imaging on the bones, for instance, can detect 3 layers in the bone. Is that sharp? You see? And of course, there's therapy devices. Of course, we're not the only one. There are a lot of competitors, but they're generally much more expensive and much more bulky. So they're not suitable for home use. So, as far as using it for therapy is concerned, what is it about THz that make it useful? One is low energy. It doesn't ionize us. That means it is safe. When you, if you go for this suntan rays, right? They give you a suntan, but because they're ultraviolet, they can harm you if you shine on your skin for too long. This one doesn't. Then it penetrates through all kinds of material. We call this material dielectric. Dielectric are non-conductors of electricity. A lot of things, wood, chair, are non-conductors, and it's very safe to use them. You can wear your clothes and you can blow parts of your body. It will penetrate through your clothes. It's absorbed by various tissues because it's absorbed by polar compounds. Polar compounds are conductors of electricity. And that's why we don't recommend you using THz where there are implants in your body because it is made of metal. So water is a conductor of electricity. You know that, right? So if THz waves meets water, you'll be absorbed by the water. And in the human body, the water and a lot of molecules are held together by hydrogen bonds or van der Waals forces. That's why the molecule can be folded. That's why the molecule can be very complex because a long protein molecule is folded in place and held in place by these forces. So because of this, THz can change the shape of molecules. And this is very important for healing and a lot of other things. And of course, we now know that human cells resonate at the same frequency and is able to regulate biological system by changing the interaction of neurotransmitters. And that's why it's able to provide healing. On the human body, there are a few things. Open up blood vessels, vibrating water molecules get activated. It's just like using microwave to heat up your water or your food. It normalizes hyperactive cells, especially those that are inflammatory, and is able to have an effect on DNA. In fact, its DNA activity is quite remarkable. So these are some of the actions that we see. It opens up blood vessels. So in your body, blood comes from the heart through the arteries and then go to the vein. Okay? This part, which is the arterial portion, is under high pressure because your heart pump, each pump is very forceful. So water, oxygen, everything leaves the capillary. So you go to the tissue, there is no pressure there, and then towards the venous end, water and all the waste products get absorbed by the blood and then go back to the heart and brought to various places to be excreted. Now because there's no pressure here to push the water and the excess solutes and the waste products into the vein, so not all naturally go into the veins, right? So you need another set system, and that's called the lymph vessels, like drains like that, drainage pipes like that. So this lymphatic system carry all the excessive water, the waste product, everything, and return them. This lymph vessels goes direct to the heart and return to the heart. Okay, so this how the circulation looks like in our body. So you open up blood vessels, and so the circulation goes faster, and that's good because if you go fast, that means you can clean out the body faster. The waste product can go back to the heart and be redistributed. The other thing you can do is to regulate the inflammatory response. There are a lot of inflammation cells in the bloodstream. All these are molecules of inflammatory cells. Usually like that. And it activates normal cells. How does it activate normal cell? Inside the cell, there are tiny organelles you can't see with the naked eye, called mitochondria. So in the mitochondria, it's like a factory. You can produce all kinds of things, all kinds of iron synthesis, gene expression, and so forth. See all the kind of activities that take place inside your mitochondria. That's where you get the energy to run, to move about, and all that. So it's a very efficient way of using energy. And the other thing that the cell needs to do is that every cell has a lifespan. Okay, usually after 120 days, the cell has lost its ability to do a lot of things. So it's time for the cell to go, and the body has a way to do it. The cell, when it reaches that stage, it cannot be active anymore. It began to manufacture proteins that send message like find me, eat me, you know, and so there are certain cells that are called lysosome or phagosome which detect this signal and swallow the cell that is at the end of its lifespan. That's how we renew ourselves, you see. And that's how those cells that are no longer useful are removed from our body. So this is how the body regulates itself. And then there are various bacteria, various viruses around. They have all sorts of shapes. All this like hair-like thing. They serve two purposes. For movement. Okay, the hair you can move. And the other purpose is to attract things. The cell, the viruses, the bacteria and all that use this to trap particles that they can consume as nutrition for the viruses, bacteria and so forth. Okay, so it has the ability to actually kill all these things, sterilize them, remove them. Quite remarkable, isn't it? These steroid waves. Then activate DNA. DNA, as you know, is like a zip. Two strands lying side by side, held together by certain forces. When they are zip up like that, you cannot activate it because, for example, this part of the DNA is able to print nucleotides. Nucleotides are protein fragments, and when it's opened up, then the printer or the primer can be active, and you can start to print out the molecule. Something like our printer, 3D printer like that. Also, when you open up the zip, you can also multiply, because when you open up the zip, another pair can form here. So one strand becomes two strands. That's how multiplication occurs inside the cell. So let's come to the kidney, which is the focus of my talk today. I'm going to talk about kidney. What's the function of the kidney? Well, as you know, in a day you need to go a few times to the toilet to empty your bladder. Filtration, remove water, extra fluid, and remove waste. And that is a very important function because waste products accumulate, so there must be a way to excrete it. One way of excretion is through the intestines. Some of the waste products that go to the liver to be detoxed end up in the intestines. Other products that are not sent to the liver end up in the kidney where they are just removed. Okay? So it also controls your acid-base balance by selectively not absorbing certain things back, sodium, potassium, things like that. So carbon dioxide is removed as a carbonate, and a lot of waste products also. Another thing is also control the blood pressure. Why you control the blood pressure? Very simple. To filter the waste products out of the kidney, you need actually a pressure, isn't it? Just like in the arteries, you
it's me.
You need a certain pressure for the waste product to come out of the blood, isn't it? So you need a certain blood pressure for that to happen. So the kidney is very sensitive because you need the filtration to take place. It therefore is able to regulate the blood pressure so that the waste product is actually excreted. That is the purpose. That's why the kidney secretes something called renin-angiotensin, which causes the blood pressure to go up. And of course, this can go haywire. In some people who are high blood pressure, because this is too active, you need certain medication that can block this. Okay, and a lot of people with high blood pressure need this system to be blocked so that it doesn't make the pressure too high. Now, also because the urine function depends on the blood, you have a control mechanism to make red blood cells. kidney produces this chemical called erythropoietin. And kidney is able to keep your bones healthy by holding back the calcium and the phosphate. This activity is depending on vitamin D, which is very important. That's why vitamin D is very important. So this is how your kidney works. Kidney is here, then there are tube leading to the bladder, the ureter and bladder, and pass out. Blood enters the kidney and leaves here. Waste is sent down to the bladder. Okay? So these are the functions. Blood metabolism, blood pressure control, all that. So this is a pictorial representation so that it's easy for you to remember. Okay? Again, another view, the kidneys. Notice that the kidney is just below the rib cage. Just below the rib cage. It's at the back. Normally you can't see this when you open up the abdomen because what you see is the stomach and the intestines, which is in the front, right? So these are at the back. And then these are ureter and this is the pelvic region. The bladder is just behind the pelvis here, the pelvic bone. And this is how it looks like. It's called renal pyramids. The drainage goes into here, the urine goes into here, and end up in the urine. So, in a healthy kidney, that's what it should look like. So, we're going to cover diseases of the kidney, and this is what I will cover. Yes? We're going to cover glomerulonephritis, urinary tract infection, kidney stones, polycystic, and finally we cover renal failure, chronic kidney disease. So what is glomerulonephritis? It's very common. It's an acute inflammation of the kidneys, usually both kidneys. They usually happen in childhood, usually more male than female. Females tend to be associated with a higher rate of infections in the urinary system for a very simple reason. The female urethra is very short, whereas the male urethra is a much longer and much more convoluted route. So it's harder for infection to come to the male, but it's easier. Okay. So glomerulonephritis can be caused by infection or inflammation. So if you suffer from lupus or rheumatoid arthritis, you can get glomerulonephritis. It can also be caused by genetic disease or other things. So the basic disease of glomerulonephritis is that the inflammation of the filtration tubules, the filtration mechanism in the kidney. And you know you have glomerulonephritis when blood or protein is detected in the urine. You know that when you go for urine test, they test whether there's blood or not. Sometimes microscopic you can see, but you can test it with the what they call the lab stick. So, what are the symptoms of glomerulonephritis? The split retention. Hands, the feet, the abdomen, and more important, around the eyes. That's very typical of kidney condition. When you see the fluid accumulate around the eye, that is a kidney problem. Nausea, vomiting, dry, itchy skin, cramps, blood in the urine. The urine sometimes, because of the blood, if there's a lot of blood that's coming out, it becomes pink or like the color of cola, like Coca-Cola, that kind of color. The urine can be foamy, bubbly, and that's because of the presence of protein. And when there is this glomerulonephritis, usually there's high blood pressure as well. So what is the essential thing is in this what is called the bolus. This is where the blood enters in, okay? And because of the pressure which the blood is under, water comes out, waste products comes out into what is known as the tubules. This is the tubules. After it gets filtered out, it go through the tubule, go through the proximal tubule is called, and then the distal tubule before it goes into the ureter. Okay? You notice that it's all surrounded by blood because when it gets first filtered out, a lot of things get filtered out. Red blood cells, protein, everything. Then when it goes through the tubules, things are absorbed back. Right? So, for example, if you're not drinking enough water, your kidneys still function normally. Everything still gets filtered out, but when it comes to the tubule, the blood will absorb back the water. Okay? So similarly, if red blood cells pass through, it will be absorbed back. So that's why these tubules are very long, because you can regulate it. For example, if you're too acidic, carbon dioxide is put out. To make it alkaline again, carbon dioxide is taken back. So this is where it regulates the body. This is how it looks like, the thing and the tubules. Okay. So the glomerulus is in the outer portion, outer layer of the kidney called the cortex. The tubules are in towards the center, and then because it's towards the center, it drains into the ureter here. See, the structure is very elegant and very well designed. And in glomerulonephritis, in the infection, you find white blood cells everywhere. White blood cells are there to attack and eat up the infection that is caused. So how do you treat? Low salt, low protein, because you want the urine to function, so diuretics are prescribed to produce more urine. One thing very important is that blood pressure is usually involved, so you need to give blood pressure medication, and you may need immunosuppressions depending on the cause of glomerulonephritis, and steroids are used. In extreme cases where there is the kidney shut down, you may need to do dialysis. That's one thing about glomerulonephritis. The good thing about glomerulonephritis is sometimes it can be very mild. Sometimes it can be very severe where they can go into renal failure at that point in time, but then they recover. So that's the good part about glomerulonephritis. Very rarely, some glomerulonephritis end up as renal failure. So 10% of all renal failure are caused by glomerulonephritis. Okay? Most people recover. There's usually associated high blood pressure. Anything to involve in the kidney usually end up this way. And then some may have a chronic syndrome called the nephrotic syndrome. I will talk a little bit about this. So if it's very severe, you need to do hemodialysis or peritoneal dialysis. That means you put fluid into your abdominal cavity, so the fluid collects around the lower part of the abdomen. So you absorb all the waste product and all the excess things from your body through the water inside your abdominal cavity, and then it's drained out again. Okay? So it is done by through a catheter here, put into the stomach. This is peritoneal dialysis. Nephrotic syndrome is a condition where, because the glomerular capsule, the part where the filtration takes place, is damaged, so there is a loss of protein, with swelling of the legs, face, and so forth. And this because of the damage to the small vessels that is responsible for the filtration process. So because it's due to different causes, you deal with the underlying cause. The loss of proteins often cause blood clots because the various clotting factors that prevent clotting have been filtered away, so the blood clots spontaneously. So it can recover. Sometimes complete recovery is not possible. When that happens, that means you keep coming back and then get better, then can coming back. When you see this pattern of repeated relapse, it's going to end up with renal failure. So basically, that's what nephrotic syndrome is. There's a lot of protein in the urine. Because a lot of protein that is lost has to do with anticoagulation. So a lot of clotting take place. Okay. So basically, the basic problem is here, where filtration takes place. The ability to hold back the protein is gone, and protein kept coming out. So you're swelling, it affects the heart, affects the skin, lipids go up, protein in the urine, and you have a lot of vomiting. So this does happen. It's not so common, but it does happen. Infection. Kidney infection is common in females, but a big portion in the past used to be sexually transmitted infections. Now with better antibiotics, with condoms and everything, it is much less. Okay. So sometimes infection occur because of blockage from kidney or renal stones. 2 to 3% of renal failure are due to infections. The key feature of kidney infection is painful urination. Yeah, if you have painful urination, it often almost always indicate infection, chills and rigors, nausea, vomiting, big back pains. In the elderly, often confusion. They have muddled speech and they see all kinds of things. So one of the things when you're dealing with elderly patients is that when they're confused, you check for infection anywhere in the body. And if you find the infection, you treat the infection, they become normal. So it's one thing that you got to remember when you're dealing with an elderly person. If you're looking at an elderly person, when there's confusion, it's not always mental or psychological. It can be physical. And infection is one of the physical causes. So that's what infection can cause. Fever, pain, chills, pain when you pee, bloody or cloudy, pee, the urine smell, urgent, you need to go many times. And it's also called pyelonephritis, that's the word for kidney infection. And when it happens, sometimes there's pus inside it, and this is quite bad if pus collects like that. Okay? So that's how the kidney looks like when it's infected compared to a normal one. Okay? So stones are quite common. There are only 4 types of stone. The commonest are only 2 types. Calcium oxalate and the other one is uric acid. Uric acid is associated with what is known as gout, right? People who have a defect in their body tend to produce this, or their diet, too much good food, meat especially, cause a lot of acid, uric acid to be produced. The other 2 kinds of stones are very rare, sugar stones and cystine stones. So I will not talk about them. And often stones come about because we don't drink enough water. And so one of the treatment for stones is drink lots of water. Dissolve the stone and everything will be okay. The key feature of stones, how do you know you have stones? Pain. Right? Persistent abdominal or stomach pain, blood in the urine. And if it causes infection, there'll be fevers and chills, nausea and vomiting. So when you collect the urine may be cloudy, indicates there's protein, or it smells. You can smell it, it's terrible. The pain is due to the irritation of the stone on the walls of your kidney or the ureter, or it can be due to blockage. Once you have a stone, the risk of you having another one is about 50%. So once you have it, you're likely to have it. And it can be chronic if symptoms keep coming and going. So there you are, stones. It's a collection of stones that people have passed out. So the stones usually form here. It doesn't matter whether they're oxalate stones or uric acid stones, but they come here. Okay. When they're too large, in the past we used to do operation, open up the kidney and remove the stone. Nowadays we have a much better technique, ultrasound, shock waves. This agitate the stone until they break up, and then they are small enough to be passed out. They break up and they pass out in the body. So the first thing is we want to know the size and where is it. So we can do that with X-ray. You take a dye and do an X-ray that's called an IVP, or do a CT scan. The complication occurs when it is stuck. And now we have this shockwave treatment. It's called extracorporeal shockwave lithotripsy, or ESWL. Or you can flush it out with drinking lots of water. Alkalinize it, alkaline water. THz water will do is alkaline, you drink it, and it goes out. Flushing out takes from anything from 2 weeks to many months. Depends on how many and how big the stones are. So you dissolve the stones and they come out completely. So that's how a shock wave machine does. The wave is right, and is aimed directly at where it is. This shock wave brings out the stone. That's what it looks like. So I want to talk a little bit about lasers in medicine. Laser beam, a laser is a beam of light, very intense, all with the same wavelength. So for it to be a laser, it must all be the same wavelength. And for it to have the effect of a laser, it must travel all together with all their peaks in phase. You heard of those electric components, right? That they say are in phase, right? So they invert those, the wave go like that, isn't it? In electrical appliances, if you remember, it's like that, right? And then they have an inverter where they invert this so that it becomes like that, like that, like that. Now, in laser, you want all to be the same frequency. That means if you are using, let's say, 500 nanometer, all must be same, and all the waves must be in sync. You can't have this wave like that, then the next wave like that, and the next wave like that. Okay? So when they're in sync, that's what called a laser is. And lasers can be from any frequency. You can have a light laser, low level laser, supposed to be somewhere here. Okay? Most lasers are in this region. Okay? So you can also have a terahertz laser. If you have all the waves in a terahertz range, that's this range, somewhere here. No, infrared, yeah, somewhere here. So if all the rays are in a terahertz range, that is a terahertz laser. And if they are all synchronized, all peak together, you have a very focused beam. And it's usually deliver at a particular energy, so it can do a lot of things. It can cut, it can do several things. Now, lasers that are not focused or not in sync, they're all over the place, scattered. You have these kind of things. So the thing is, our THz blower, alright, is not a medical device. It's not meant for medical treatment. Why they say this is because of these properties. All the waves are not in sync, and all the waves are not all of the same frequency. There are few frequencies there. So the effect is that it smears out. Medical grade lasers are very focused, very sharp. That's why they are all very highly effective. And in fact, THz lasers, they are infrared lasers, which is in this range, very close to THz but not THz. And they are now developing THz lasers, which is very effective. But don't please use this as a treatment. Don't have a clinic and start treating, because this is not medical grade. It's not calibrated and controlled that well. Okay. So, but it's effective. If you use it generally just to prevent stones from occurring, if you drink lots of water, you should be able to use this to maintain your general health, but not to treat something like if you are definitely having pain when you are urinating, when you are having blood in the urine. Please see a doctor, get it properly treated. You are better off doing that. So much about lasers in medicine. Now you realize that what you have is a very powerful device that can do a lot of things, but not able to do everything. That's the best way to put it. So it's very, very effective, certainly. Now we come to polycystic kidney. This is a genetic disease. It's known as an autosomal dominant. What it means is that all of us, any gene, we have a pair, right? One you get from your father, one you get from your mother. Autosomal dominant means that this gene is so powerful that if you inherit just one copy of the gene from your father or mother, you have the disease. So it's fairly common, 1 in 1,000 live births. Usually both kidneys affected. The onset of symptoms is during adulthood, 30 to 40 years. Life expectancy, you are expected to live between 53 to 70, slightly less than normal. Slightly shorter life. There's no cure for this. The medication that's available only slow down the rate of cysts forming. There's an increased risk of cancer. So, what's the symptoms? Back pain, the abdominal increase in size because of the cysts, blood in urine, frequent infection, blood pressure, all that, pounding and fluttering on the chest. Cysts can also occur in other places such as liver, spleen, colon, pancreas. Alright? People on long-term dialysis, if you have somebody on long-term dialysis, they can also develop cysts. The older you are, the more you can develop renal failure. So this is how cysts looks like. So it's a genetic disease. Okay? The symptoms are blood in the urine, you can see it, high blood pressure, pain. So as I say, this is a genetic disease. There's nothing you can do about it. You can slow it down. Diabetic nephropathy. Now this is a complication of diabetes. It's a very important complication. You see, one of the biggest problems of diabetes is not diabetes itself, but the complications. And this is a complication of diabetes. So in diabetes, there's damage to the blood vessels, and the damage is usually due to high blood pressure. And there's no cure. Once your diabetes is so bad that it damages the kidney, that's it. That's why in diabetes it's very, very important. It's very, very important that you get your blood pressure under control. Because if you get your pressure under control, that's damage. If you don't control your blood pressure, your diabetes will definitely get worse. And when it gets worse, it affects your kidney. See? So very, very important. Very, very important that you get diabetes under control, because once your blood pressure, if you don't take enough medication to regulate it, plus your diabetes, it will destroy your kidney. Now, suppose, let's take normal kidney, which can filter your water. And let's say, normally you can filter up to 90% of the water. Okay? When your kidney filtration ability is gone, you can only filter about 20% or less, or 30% or less. The less you can filter, the more your kidney is not working, isn't it? That means all the worst waste products is still there. No effect at all. The only way you can get it under control is to control the blood pressure. Very, very important. So uncontrolled diabetes leads to high blood pressure and kidney damage. The survival rate for 10 years, yeah, a lot of people survive. 30 years, only half will survive. So the longer you are, you don't control it, the worse it is. All diabetic patients will develop some change in the kidney within 2 to 5 years. Very important to remember that. So complication in diabetes at the cellular level, it can cause your eye to be damaged, it can cause your kidney to be damaged, it can cause your nerves to be damaged. That's why a lot of diabetic end up with their legs amputated, right? You've seen them, isn't it? It's because of all this damage. Right? So on a gross aspect, when you take the body and the organ system, macrovascular, that means it affects the vessel, it can cause a stroke in the brain, it can cause a heart attack, it can cause the legs to die, and when the legs die, that's where it get amputated. Very simple. If you think of it this way, that diabetes causes clots. The clots go to the brain, you got a stroke, isn't it? The clots go to the heart, you got a heart attack, isn't it? The clots go to the legs, you got to cut it off. So that's where it is. So it's terribly important that you remember this. So when your kidney gets damaged, that's what happens. Protein gets leaks out, protein in the urine, swollen ankles, nausea, fatigue, dry itching skin, you can't concentrate. So in a way, we should not talk about diabetes, we should not talk about kidney, we should talk about the whole body, right? The whole body is like that. Everything affects other things. So end-stage renal disease. This occurs when the kidney is not able to function anymore due to whatever cause, end-stage. Commonest cause, of course, is diabetes. Is the cause of 80-90% of kidney failure. Diabetes is the biggest cause.
How to prevent from getting diabetes? How to prevent?
You got to make sure that your blood sugar level is as low as you possibly can get. Maintain your blood sugar level by diet and a lot of other means. I gave a lecture on diabetes sometimes back, few months back. You can look at YouTube what I say. Diabetes also make you age faster. It's important to know that. So the major cause of kidney malfunction is diabetes and high blood pressure. So how do you measure the severity of kidney function? By what we know as a glomerular filtration rate. It means how much your kidney is able to filter the water. Normally, it's more than 90 mL per minute. So, mild is between normal and moderate. Moderate is about up to 60. So that's about only 2/3 of normal, isn't it? Severe is up to 30 mils per minute. That's 1/3 of normal, isn't it? End stage is less than 50. It's like your kidney is already packed up. It's no longer functioning. So if your kidney is no longer functioning, that's why it's called end stage. Your kidney is no longer functioning. And because it's mostly due to diabetes, it is something that we can control. And that's the message I want to give you. That you can ensure that you live to a healthy, long life if you take care of yourself. If you don't, this is one of the complications.
So deal with diabetes with high blood pressure first before, huh?
Yeah, you get diabetes first.
Cure yourself of diabetes
Yeah.
first, so you'll be...
Control. You can't cure, you can control.
Oh,
And the high blood pressure. Because high blood pressure can give rise to diabetes, diabetes can give rise to that. The two are connected. Yeah? Survival. 1 year survival is good if you're below 65. If you are more than 85, very poor chance of survival. So that's end stage kidney disease. And the thing about renal failure is that many people who are in renal failure don't know why they end up in renal failure. Sometimes it can be undetected kidney disease like glomerulonephritis, as I explained to you earlier. Sometimes it's due to dietary factors. They have long stones, because of lack of water consumption and so forth, and a lot of other things. Or high blood pressure which they are unaware of, untreated. So until they fainted or they have a heart attack or something, then they discover it, and that's what happened. You see? Because the kidney is a very sensitive disease. So what are the symptoms like? You feel unwell. You feel tired, itchy skin, headaches, weight loss. Weight loss without trying, that means you are not losing weight and yet you are losing weight. Loss of appetite. Early warning signs, dizziness, tiredness, swelling, and change in urinary habits. So the ability to filter is lost. So one of the change in urinary habit is that suddenly you produce very little urine. And that is a sign. Quickly go and check it out. What is wrong? The thing about end-stage renal disease is that you cannot survive without either dialysis or kidney transplant. And because there's a lack of transplant kidneys, there is a criteria to decide who is a candidate for transplant. So let's say a kidney is available. So if you are old, you have other diseases, you have high blood pressure, you may not suitable to be a transplant candidate. So they think all those are suitable, they got to still have to match, right? They match by looking at the tissue of the donor and you as a recipient whether it match or not. Because if it doesn't match, you will reject, and when you reject, the whole thing gone. So it's a very very dicey. You're playing with your life. Outcomes, the only treatment for end-stage renal failure is a transplant. So you have a better chance if you are young, if you don't have any other kidney diseases, that is no diabetes, no high blood pressure. Dialysis is there to relieve you of the symptoms of renal failure. So dialysis, I've shown you already. So you can do hemodialysis or peritoneal dialysis. And of course, you need to pay attention to your diet. You need to control your blood pressure. Diet has to do with your diabetic quotient, low protein, low salt diet, medication to make sure that your blood pressure is within normal limits. If they are not controlled, your kidney will eventually pack up. Anyway, when you are end-stage renal failure, your kidney is already packed up. So there's nothing there. With dialysis, half of patients can live 10 years or more. That's true. But because it's very troublesome, you see, last time you got to go to the dialysis center 2-3 times a week, right? Now you can do it at home. So while you're asleep, the dialysis machine will work to clean up your blood. If there's no medical support, they die within a few weeks. So in Singapore, if you are under a dialysis program, you get dialysis, there is a lot of financial support. But if you get admitted to a hospice, the support for dialysis ends, which means that you can expect to go off in a few weeks' time as the waste products accumulate in your body and kill you. So, end-stage renal disease. It doesn't look like a normal kidney, isn't it? All messy and chaotic. That's what it looks like. When you do a kidney transplant, that's where a transplanted kidney ends up. By the side. Because your original kidney is here. You can't put it here. The disease, they're useless. You see? So you put it here, next to the blood vessels, so blood can go in and do whatever. There's also, you need to transplant the ureter to drain your transplanted kidney and go out. You didn't know that the transplanted kidney is there? You're surprised, right?
Don't they take out the disease one and put no?
They cannot. Cannot be done.
Yeah, all disease.
To be practical, you can't do it. It has to be like that.
Like heart, you take out
either this side or this side.
You
Depending
take out
on
heart and put a new heart. What is different?
new heart, you have to because there's not
No
much
place
space.
for this heart.
But in kidney, you can have some space here for you to do that. So, hemodialysis, you need a shunt. Now, THz radiation appear to help with hemodialysis. It's been found in several studies, especially in Taiwan. They found that it helps. Peritoneal dialysis, it can be done like this. You can be seated or you can be asleep. So the carriage, as I said before, you bring fluid into your abdominal cavity, all the waste, everything come out, and then it drains away. So this prolongs life.
It doesn't clear the kidney. Go through the tummy, the abdomen.
No, this peritoneal dialysis. This is a peritoneal cavity. This cavity can be used for drainage, for a lot of things.
Oh.
So to be complete, I cover, there are only two cancers, so I just cover very briefly. There are only two cancers. One is Wilms tumor, one is renal cell carcinoma. Wilms tumor is a very fierce cancer occurring in childhood. Usually 3 to 4 years in a toddler, caused by gene mutation. And if a young child you feel lumps in the body, that's Wilms tumor probably. Survival rate is very good. 5-year survival rate is 93%. It's very excellent. So, young child, Wilms tumor. Okay. Renal cell carcinoma is the most common of kidney cancers. The rest, 15%, all kinds of other cancers. It's a cancer that grows from the cells of the tubule. It's not a very common cancer because of all cancers, kidney cancer is only 1 to 2%. So a very tiny portion. And how do you know? Blood and urine, pain, and you can feel a mess, a lump in the tummy. Treatment by surgery, chemo, and targeted therapy. 5 years survival, if you are stage 1, very good chance of survival. When it's stage 4, you can say goodbye to all your friends and your family. This cancer is interesting because this is one cancer where targeted therapy, that means biologic therapy, that means you use normal human protein. For example, interferon, some of this protein that are produced by our body, they use this to cure you of the cancer and appear to be quite effective. So that's what it looks like. Stage 1, if it's just inside your kidney, your best chance of survival. Stage 2, when it spill out, still can survive. Stage 3, when it's spread outside the kidney. Stage 4, when they go to all over the place, like the brain, the lungs, the heart, and elsewhere. So if it spreads so widespread, when it's so widespread, then you are not likely to survive. If it's stage 4. Okay? Now, I want to say a little bit about kidney diseases. It's not surprising that people look at THz wave in relation to kidney. Okay? Because, let's face it, people find the sun, rays from the sun, very helpful, isn't it? It's supposed to be very healthy. And kidney is one place where water comes out. And anybody who has gone to a sauna will know that you sweat and then you pass out water. So invariably, there comes a time when infrared sauna existed, where you're able to sweat it out and pass out water. Okay? So the danger of sauna is that you don't drink enough fluid, you don't pass out, then you can produce stones. So you go for your sauna, and then people find that infrared sauna, there is a difference between infrared sauna and normal sauna, which is just heat. And this shouldn't surprise you. And so it's not surprising, therefore, that when people start to research into THz, that people not only use it to image, because I show you already, the kidney is just behind, just below your rib cage. So it's easily accessible. It's not covered by any other things except your muscle. So really, it's very accessible to any radiation from outside, including THz waves. And indeed, in renal failure, THz has been tried in many places. So the conclusion is that if you use THz waves and radiate the nerves, the nervous system, the head, the spine, the endocrine, and the kidneys, it will help. In fact, they not only think it will help, they actually think that THz, which is far infrared, in renal failure, perhaps a possible cure. Because they see some very positive changes when you shine THz. Isn't that interesting? So, therefore, it's produced a lot of interest and caused a lot of people to look at this. You see? Certainly in diabetes, they found that THz can improve your sleep, decrease stress, and helpful with all these things, the fatigue and all that associated with it. And we know for hemodialysis, THz keeps your fistula patent. It doesn't clot. So people are using it for that. So that's quite amazing, isn't it? That so much work has been done using THz radiation. And so therefore, it shows that THz wave is effective, not only in this condition, but in other conditions elsewhere in the body. It will have similar effects on you. But of course, this is not a laser, a medical laser. So it will not have the benefits that medical laser give you, which is much more focused and targeted, which this one isn't. It's for home use, which you can do it yourself. So as far as renal disease is concerned, we recommend this. Lost weight, stop smoking, brisk walk, manage your stress, lower your blood pressure, make sure your blood sugar is controlled, restrict your salt intake and protein intake if necessary. And of course, you want to go for regular health checks to make sure that you are not at high risk for anything. This is the usual standard advice given to you, isn't it? So, at the end of the day, it's about choices. As you can see from what I say in this hour or so, that a lot of the illness of the kidney stem from your choices, stem from diseases like diabetes, blood pressure, which is a result of the choices you make. And my message to you is just have a happy, healthy life. You know, make sure you're serious about things, but make sure you have lots of fun as well. Enjoy life so that you are happy. So for me, THz is to repair whatever that's broken down and regenerate and make you look and feel younger. We don't use THz for this condition. For this condition, for inflammation, pains, blockages and so forth, but we don't use this for this. Okay? Although I must say that for open wound, there has been a spate of research paper. We say that THz promote wound healing. So in fact, open wound it can be used. So it's something that we got to catch up with. It is something that I find that the research is much more advanced than the recommendations that we're giving. Acute diseases is better get medical attention because acute diseases can change for the worse very rapidly. Well, thank you. And this is the health scan which I do for people. This scan tells you which part of your body is not functioning well. And so if you don't know what's wrong with your body, you do a scan, you can tell you where you should scan, where you should use your THz blower to blow to recover normally. And if you want to scan, I can offer you at a discount for $99 and I can do it for you. I do a lot of other things. I have 2 books which on sale here, as well as online courses which are available. So if you find my talks useful, please support me, give me some encouragement by buying my products, buy my books, or come for virus instead.